Assalamualaikum, a well-known gynecologist, Dr. Sana, is with us, and she will give us the review about obstetrics.
This is the Obstetrics by 10 Teachers 20th edition. This is the book for final year MBBS Obstetrics. Today I will give the overview about important chapters and important topics of final year MBBS Obstetrics. First priority chapters are antenatal obstetric complications, multiple pregnancy, preterm labor, hypertensive disorder of pregnancy, labor, normal and abnormal, OBS emergencies. And the rest of the chapter 1, 2, 3, 4, 5, chapter number 10, 11, chapter number 13, 15 and 16, they are second priority chapters. First of all, we will start with chapter 1. This is about obstetric history and examination. You will give a single reading of this chapter. Then the second chapter, antenatal care. In this chapter, aims of antenatal care is important, UQ, and summary of booking visits is also important. And the rest of the chapter you will give a single reading. Then third chapter, normal fetal development and growth. Normal fetal development you will give reading for MCQs, and in this chapter amniotic fluid composition is important, UQ. Then we will come to chapter 4. Chapter 4 is assessment of fetal well-being. In this chapter, you will give a reading of the whole complete chapter, and CTG is important. Then in fifth chapter, which is about prenatal diagnosis, you will read invasive testing about amniocentesis, chronic villus sampling, and chordocentesis and Down syndrome. This is important SEQ, and Down syndrome is important SEQ. Then chapter 6. Chapter 6 is very important chapter. In this chapter, you will read oligohydramnios, polyhydramnios, fetal malpresentations at term. These are all SEQs, and causes of vaginal bleeding is also an important SEQ. RH isoimmunization and ABO incompatibility. This is also very important SEQ. Chapter 7, which is about multiple pregnancy, is a complete chapter, which is very important chapter for SEQs, and you will read this complete chapter. Then chapter 8. Chapter 8 is about preterm labor. Preterm labor, you will read causes of preterm labor, management of preterm labor is important SEQ, and management of pre-prom is also an important SEQ. Chapter 9 is hypertensive disorders of pregnancy. Hypertensive disorder of pregnancy, you will read complete chapter. This complete chapter is important regarding SEQs and MCQs, but pathophysiology of hypertension in pregnancy, this is an important SEQ. Management of eclampsia, preeclampsia is also an important SEQ, and gestational hypertension versus chronic hypertension is examiner favorite question in Viva OSP. Fetal growth restriction is important SEQ, and HELP syndrome is important SEQ. Then in chapter 10, which is about medical complications of pregnancies, you will only give a reading to diabetes mellitus and gestational diabetes mellitus and thyroid disease in pregnancy. Rest of the chapter is not that much important. Chapter 11, you will only read this chapter for MCQs. Then chapter 12, which is labor, normal and abnormal. This is a complete chapter, which is very important chapter regarding MCQs, SEQs, and regarding OSP. In this chapter, maternal pelvis and all the anatomy of maternal pelvis, fetal skull diameters, these are important for MCQs and for Viva. And normal labor mechanism, management of normal labor, this is important for SEQs. And in this chapter, you will also encounter partogram. Partogram is important. In partogram, this is important that how to make partogram for examiner Viva question. And bishop scoring is also important in this chapter. Then chapter 13. Chapter 13 is operative delivery. In this chapter, you will only read a table for grading of perineal tear. This is important SEQ. Episiotomy is also important SEQ, in which you will be given a question of how many layers of episiotomy are there, and in which grading of perineal tear episiotomy exists, and indications and contraindications and prerequisites of instrumental delivery. These are important. Only vacuum delivery and forceps delivery are important in this chapter. And then we'll have chapter 14, OBS emergencies. obstetric emergencies. This is also very important chapter. You will give complete reading to this chapter: placenta previa, placental abruption, cord prolapse, and postpartum hemorrhage. They are very, very important, and they are very important from SEQ, MCQ point of view. Then chapter 5, in chapter 15, chapter 15 is important for reading, and you will also only give a single reading to puerperal sepsis and psychosis, which are important for SEQ, advantages of breastfeeding, which is also important for SEQ. And chapter 16, you will only give a reading.
Dr. Sana is gynecologist at Farooq Hospital, Lahore. Thank you so much, Dr. Sana, for your time and courtesy.